Hello friends, welcome to YouTube channel HealthQ, the place where our mission is not only to motivate you, help you to move on to the bright side of the health. In this video, let's discuss what is the treatment for Bell's palsy. Now, Bell's palsy treatment is not just limited to exercises or electrical stimulation. It's far more deeper and is in layer. So, in this video, let's understand phase by phase and step by step what is the ideal treatment process, because if the treatment goes right, you can get better outcome. There are a lot of people who recover from Bell's palsy very quick, but there are few who are left with residuals that last forever, and that's why the initial 3 months of your Bell's palsy is your golden period. The right treatment done at this phase makes a huge difference. That's why having a proper understanding of this treatment and doing this treatment right is extremely important. So let's understand the treatment for Bell's palsy. So friends, whenever someone is diagnosed with Bell's palsy, the first instinct is let's fix this and get the movements fast as much as possible. The honest answer is it doesn't work that way. There is a timeline of recovery to this condition, and that timeline needs to be respected. There isn't one magical treatment, but a series of treatment and practices that, when done right, gives you the right outcome. Bell's palsy treatment usually happens in phases, and it helps you to recover from different impairments that you experience due to Bell's palsy in different phases. So let's walk through it clearly. The number one here is the early phase of your Bell's palsy. When I talk about early phase, I'm talking here about your first 72 hours, the confirmation phase. At this time, you have just developed Bell's palsy and there is a severe amount of inflammation that is present inside your body. Bell's palsy is most commonly linked to the inflammation of your facial nerve. When this nerve swells inside its narrow bony canal, the signals can't pass through properly, leading to facial nerve paralysis. That's why the oral corticosteroid treatment is the most important treatment as soon as you develop Bell's palsy. Don't delay in this process. The moment you develop Bell's palsy, see a ENT doctor or else a neurologist or else a nearby physician and get your dose of corticosteroid started. When corticosteroid is started within first 72 hours, your likelihood to complete recovery increases far much than without taking treatment. Corticosteroid will reduce swelling and will protect your nerve from prolonged compression. The next is antiviral medication. Sometimes doctor prescribe it if they suspect some severe viral infection. Their benefits are less clear than the benefits of steroid, but when there is a particular infection, known cause like Ramsden syndrome, in that situation, prescription of antiviral medication becomes very important. But remember, timing matters here. The earlier the inflammation is controlled, better is the nerve environment for recovery. The second important thing that needs to be done in this early phase is eye protection. Since your eye cannot close completely, that's where it is at risk of infection and inflammation. The facial nerve controls blinking, and when it is lost, it makes your eyes dry and also susceptible to infection, giving you tearing as well. That's why use of tear drops is very important when you have developed Bell's palsy. Some simple helpful measure that you should take care of is lubricating your eye with tear drops. Number 2, stretching your eyelids every 2 hours, using protective ointment at night, taping your eyes at night, and wearing protective glasses outdoors. Now let's move on to the next important part of early phase of Bell's palsy, and that is facial massages. Yes, I did mention here facial exercises. Well, facial exercises are good to do, but have less importance in the early phase than in the other phases of Bell's palsy. But what is the most important thing in the early phase of Bell's palsy is facial massage. Because when you do facial massage in the right way, you can actually stimulate your facial nerve. Right, that's biggest misconception that people have, that for stimulating your nerve you only need your electrical stimulation, but that's not the case. Even your sensory receptors can be stimulated with the help of your hand. So massage plays a very significant role, especially when the massage is done following the anatomical guidelines. At that time, the massage gives you the best outcomes. That's why massage is extremely important when it comes to Bell's palsy. Make sure random forceful exercises done at this time can harm more than doing any good. So please don't do any kind of random forceful exercises just watching any kind of random videos. That can increase your tightness, can give you facial pain, and can develop some wrong movement patterns on the face. That's why this is an important one. So After massages, what else needs to be done? Well, you have to take care of your overall health and well-being. That's where your diet, your sleep, and your overall lifestyle matters. You don't need to be bedridden. You need to be active. But at the same time, you need to make sure that you don't overexert your body. Give the rest that your body deserves. That takes me to the next phase of Bell's palsy recovery, and that is the middle phase, which is somewhere between 3 months to 4, 5, or 6 months. Now, this phase is the most confusing one for people, because for some the movements come absolutely by this time and they recover completely, and for some it might take little longer and they see that some movements have come, some movements have not recovered, and they are left clueless what needs to be done. That's why here a structured rehabilitation protocol plays a role. Well, in this phase there is no role of medication, but yes, supplementation do help. So a prescription of right kind of supplementation will be definitely helpful for you while you are going through this phase. But what matters the most is the rehabilitation in this phase. Now, when I talk about rehabilitation is not just about exercises and electrical stimulation. It's far more deeper, far more strategic than people think. The rehabilitation in this phase depends on 2 factors. Number 1, which muscles are tight and tensed or are likely to get tight and tensed, and what is the available strength or mobility of the muscle. What we do here is we do a personalized assessment to make out which muscles are functioning and at what grade, and based on that functional level we determine what kind of exercises needs to be done. The exercises range from passive to active assisted to active to sometimes isometric and sometimes coordination exercises, depending on what is the capacity of the muscle. Again, the word of caution that we give to everyone suffering from Bell's palsy, be it at any stages: don't do any kind of random facial exercises. It can do more harm to your face than good. That's not all. You might start experiencing tightness at this phase. That's why a deeper massages like a buccal massage or else a myofascial release massage is needed at this phase. That's where you need a bit of professional help. So make sure that if you are experiencing all of these and it's been more than 3 months and you have not recovered from your Bell's palsy, then definitely seek help from a rehab professional who is experienced in facial rehabilitation. By the way, here I would like to tell you that we at HQ are specialized in facial rehabilitation. In fact, we are dedicated to do facial rehabilitation. That's our motto, that's our mission. So if you want help for your Bell's palsy and if you want to work on the rehabilitation of your facial muscles, then feel free to reach out to us. Now, the most important point at this phase is the risk of synkinesis. This is the phase where you can start observing synkinesis. Now, how does a synkinesis felt like? Now, this will be something that will come in a very subtle way, where you will observe that whenever you are trying to raise your eyebrows, close the eyes, or do any facial movements, there are some extra contractions or tightness or stiffness felt in the other part of the face. This is a sign that synkinesis might kick in. And this is also the time you need to understand that you need to slow down your exercises and you need to seek a professional help. So keep a very close watch on your face at this phase. That takes me to the phase number 3, which is the chronic phase of Bell's palsy. Here it's been more than 6 months, you have not recovered and you have developed certain extent of synkinesis. Now here you have got 2 problems. Number 1 is an incomplete recovery from Bell's palsy, and number 2 is the synkinesis, which is an outcome of Bell's palsy. Also, you can say secondary complication of Bell's palsy. Now both of these condition needs to be managed at this time, and this is pure work of strategy and creativity. Now, why do I say that? Well, here the rehabilitation protocol is the game changer. At this phase, we need to identify which are the muscles that are contracting out of will, or else you can say involuntarily, which of the muscles are contracting be lesser than its potential, and we need to train these muscles separately. And that's why a lot of people who put in the comment section that please give us some exercises for synkinesis, we cannot give you, because if you do the exercises wrong, it can harm you more than good. That's the reason it's very important that the exercises that you do for your synkinesis, it should be extremely personalized depending on your condition. At this phase, you need some advanced treatment like advanced facial retraining, biofeedback based therapy, relaxation techniques to reduce the tightness from the unwanted stiff muscles, stretching practices to work on the shortened muscles, and sometimes botulinum toxin or as Botox injections on the non-affected side to bring back the symmetry on the face. But you need to remember here, Botox is not the cure for Bell's palsy nor synkinesis. It's just a temporary way to bring symmetry on the facial muscles. But it works best when combined with facial retraining, as it allows the muscles to train properly. So what does not help at this time? Well, let me be blunt here. Few things will not work at all. So if you are doing them, please stop it. Aggressive electrical stimulation. If you are still continuing electrical stimulation in your chronic phase of Bell's palsy, you are wasting your time, energy and money. Please don't do that. Number 2, high repetition strengthening exercises. If you are doing facial exercises, trying to strengthen your facial muscles, and you are applying a lot of strength to do that, that's not going to work. If you are doing face yoga, that also might not help you at this stage. You need to go very strategic at this phase, so make sure that you avoid any kind of random facial exercises that you see on social media. And last but not the least, some random routines without evidence. There are no evidence-based exercises that have shown that doing face fitness, face gym, face toning practices that will help to reduce synkinesis. It can backfire. That's why it's very important that you don't go for it. Having said that, doing a right treatment approach where we know which muscles are over-contracting, which muscles are under-contracting, and we train those muscles, that's where you can achieve right treatments. That's where you can achieve right results. Hence, it's very important that you take your recovery little seriously than what the random videos show you and claims that this exercises is going to treat your Bell's palsy completely. That doesn't work. If that would have been the case, there are thousands of people across the globe who are still recovering from Bell's palsy and synkinesis. They would have got results till now, but they have not. The reason being, it's not that simple. It's a complex problem. If you look at the big picture, most of the people recover from Bell's palsy very easily, many within months and many within weeks. Always. But recovery is not always linear. It can be up and down sometimes. And it's not just about your movements recovering. It's about your movements returning the way they used to move before. That's why the treatment that truly helps is the medical management that you take in the initial phase of your Bell's palsy, the facial retraining that you go through in your recovery phase, the protection that you give to your facial muscles while going through your day-to-day routines, respecting the biology of the nerve healing, taking care of your nutrition, your emotional well-being, and giving adequate rest to your body, and intervene intelligently when suffering from synkinesis. So, in a nutshell, Bell's palsy can be frightening for you, but you don't need to be scared. You need to be brave. Your identity, your communication, and your confidence can be regained back. It requires a strategic approach, not a random treatment. So the key is not in doing more. Key is doing things that is right. And if you want help, feel free to reach out to us so that we can guide you across your recovery process. On that note, I'll end this video here and I'll see you in another video. Thank you.